The news broke yesterday. Former President Joe Biden diagnosed with prostate cancer. Biden's office confirmed it is an aggressive form of the cancer. So today, Dr. Theodore Manny, a urologist in the Triad and member of the Cone Health medical and dental staff, is helping us understand the danger, the diagnosis, and the treatment for prostate cancer as well. All right, so let's just kind of start with the basics. What is prostate cancer? How does it develop?
Absolutely. Thank you for having me. The prostate in a man is a gland that's involved in reproduction and that unfortunately has a very high propensity to form cancers, kind of like how breast cancer form in a woman. Similarly, in a man, prostate cancer is pretty darn common.
Okay, how common is it compared to like other cancers? Maybe to give us some context.
Absolutely. So behind skin cancer, it is the most common malignancy in men, absolutely. And about 1 in 7 men will be affected by prostate cancer.
Okay, so let's talk about some risk factors, whether that be age or lifestyle or ethnicity.
Absolutely. So you nailed a lot of them right there. First is age. Prostate cancer is generally a disease of older men. It's pretty uncommon to be diagnosed before age 50, and the risk goes up thereafter. In terms of risk factors beyond age, ethnicity is also a large one. Folks who have African descent are at a higher risk of prostate cancer and a higher risk of aggressive prostate cancer. Family history plays into it some too. Those of us who have a father or a brother who's had prostate cancer, that does increase our risk some too.
All right, so with that said, what are the guidelines for when you should be starting to get screened for prostate cancer?
Absolutely. For most men who don't have a family history, at about age 50 is when we generally start screening, and that's with a blood check and exam both. Blood check and exam, because neither are really perfect. For men who do have a stronger family history, we generally start at age 45.
Okay, and so 40, 45 or 50 and PSA testing and other types of test screenings as well. So if your doctor's not only doing one, you need to ask for something else?
That's exactly right. And, although we don't have all the facts, it appears that for Biden, for instance, it was not the blood work that caught him, it was the exam that did. So you're correct. Both are important, the blood check and exam both.
Okay. Maybe there are some men who probably haven't gone to the doctor. Their wives are like giving them the evil eye at the moment, like you need to go get checked. Let's talk about maybe some common symptoms of prostate cancer so that we'll all kind of be in the know of what we should be looking for.
Sure. The most common symptoms are going to be changes in urinary function. Urgency, frequency, or maybe seeing blood in the urine. Those can be early signs of prostate cancer, but confusingly, they can also be signs of non-cancerous prostate problems, but that still need attention. But changes in urinary pattern, blood in the urine, those are the biggest symptoms to watch for. Or also new bone pain. Prostate cancer, if it spreads, it likes to go to bones. And unexplained bone pain as we age, that can sometimes be a sign.
Okay, and when you said like the patterns of like when they go to the bathroom, so often we kind of pass that kind of stuff off like, oh, I've been drinking a lot of water lately, or I always get up in the middle of the night. I guess I should stop drinking after 10 o'clock. How much of a change are we talking about?
It's a great question because those things do change some as we normally age. For a man in their 50s to 60s, once to twice a night is actually pretty common. But if it's 5 times a night, that's a problem.
Okay, gotcha. All right, let's talk about the stages of prostate cancer. So we were talking about how the former president was diagnosed with a later stage. Kind of walk us through the different stages.
Absolutely. So fortunately, most men are caught much earlier than the former president. Most men are caught in stage 1 or stage 2, which basically means that it's still isolated to the prostate alone, and the chances of cure are very high. So stage 1 and 2, isolated to the prostate alone. Stage 3 is where things start to get more risky. That's when it has spread a small amount outside the prostate, but is still pretty close. It's still pretty close to the area where it started. But stage 4 is where things get very, very risky. That's where the cancer is spread other places, usually to lymph nodes or to bone, and that's when we consider it metastatic. And unfortunately, at that stage, it's usually not curable, but there still are some great treatment options that can still increase a man's longevity significantly.
I know a lot of the talk was that he is out of the age range for when people are usually screened for prostate cancer. I know you said it started at around 45 or 50. Is there an end time of usually when men no longer get screened for that?
Absolutely. And this is where things get kind of fuzzy, especially for the former president, is because you're correct. At his age of 82, he was outside most screening guidelines. For most men who are, again, of average risk, we stop the blood check and exams at around age 70. For men at a higher risk at age 75. But the former president at age 82, he was outside all screening guidelines. You're correct.
And why is that? People would wonder why. It's the same thing for colonoscopies and stuff too. Once you get to a certain age, you no longer do that. Why is that?
Again, it's kind of counterintuitive. And a lot of it has to do with the fact that since prostate's more common as we age, there's lots of false positives. There's lots of cancers that are picked up that probably would never cause a problem. And we certainly, as a profession, don't want to over-doctor people and over-treat people. And so on average, we wind up, we think, maybe causing more harm than good after a certain age. And so that's why we generally do stop, is because there's so many more false positives as we get to be in the older stages of life. But unfortunately, there are cases, rare cases, where it can still be problematic.
We talked a lot about how do they screen and things of that nature. How about we get to the point where we're living life right? How do we keep ourselves from getting that kind of diagnosis, or what kinds of things can we do to give ourselves a better opportunity for that?
Absolutely. Unlike things like lung cancer, where smoking has a high association, prostate cancer is one that actually is not as dependent on lifestyle changes as other ones. But that being said, there are some things that definitely help. Maintaining a lean body weight certainly helps. When we carry excess weight, that does increase our risk of several cancers, and prostate is certainly one of them. Another is just being careful about hormone supplementation. There are some hormone supplementations out there that, if not really managed well, that can increase our risk of cancer significantly of the prostate. So just really best to be managed by a reputable provider.
Gotcha, yeah, because you hear ads all the time about all kinds of like male hormones and things of that nature. Make sure you're talking to your doctor about whatever you're taking. Okay.
Correct.
Let's talk about some of the treatment options for those who are diagnosed with prostate cancer and how the treatments kind of differ based on the stage or age of the patient.
Absolutely. Getting back to where we were talking before, stage 1 and stage 2 cancers, the ones that are isolated to the prostate, incredibly curable with surgery or radiation. For ones that are still more aggressive. For cancers that have gone beyond that, that have spread other places, like in the case of our former president, things like surgery and radiation really don't make much sense because they really don't offer cure. But there are some therapies that offer a significant benefit. We're actually in a pretty fortunate era where there's been an explosion in new therapies for men like this. Medicines that work on blocking the signals that tell the cancer to grow, medicines that actually attack the cancer directly. There are many options that work incredibly well that actually have very few side effects, and men can go on living a very normal, productive life for decades, even with prostate cancer that has spread other places.
Yeah, I'm glad you hit the side effects, because that was going to be the next question of, I'm glad we have new drugs, but what do they do to you? Because that is always the question. There is a certain kind of treatment, it's called active surveillance. Can you talk about what that is and what the pros and cons of active surveillance are?
Absolutely. Active surveillance is kind of at the other end of the spectrum from where we were talking about. Active surveillance basically is for men who have a very, very small or very, very non-aggressive prostate cancer, one that has a very low likelihood of spreading or causing problems. In that situation, we try to find a balance of not over-treating a man or subjecting them to surgery or radiation that can have side effects. And so with surveillance, we make a conscious decision just to monitor the cancer. And we use tools such as blood work and imaging and even repeat biopsies to make sure that the cancer is not changing. And if it stays small and stable, we decide to live with it instead of fight it.
All right, so we're talking to all of the men out there, but we're really talking to all of the people, the women out there who love their brothers, their dads, their spouses, their grandparents, whatever. So how should we kind of like help that? Like as in, do we need to tell them they just need to go to their general practitioner once a year, or do they need to go to a specialist? What do we need to make sure that they're doing?
Great. The main thing is just making sure that we have that good primary care doctor that we're going to. Especially for us men, 40 and over, we need to be getting that annual check. And we're the worst about it. Women are a little bit more fortunate in that most of them are used to seeing their gynecologist regularly and having that more ongoing care, even from their teens, 20s on, men tend to have these gaps in healthcare where we don't see practitioners kind of from our pediatrician until we're older men. And so it is important for us to start seeing a good primary care physician or nurse practitioner, PA, when we're about age 40. And for those of us who are not men, but have somebody that is in our life, encourage that fella to go ahead and get established.
Yeah, thank you so much for your time and expertise, especially since it was so timely after this weekend. We appreciate it.